Leadership in Focus, powered by BIMT Campus. Telemedicine is emerging as a transformative force in healthcare delivery and especially in the terms of healthcare accessibility. Leadership in Focus connects with Mr. Lahiru Karunarathna, CEO of oDoc Private Limited. Welcome to the show.
Thank you.
As the head of a company at the forefront of healthcare technology, how do you balance the need of innovation with maintaining a high standard of care and safety?
Innovation is something which is evolving pivotally in any industry at the moment. Given the new evolvement in technology and the things like AI, it has been something unavoidable in any kind of an industry globally. So, if I compare the telemedicine in Sri Lanka to the global level, we are just starting. So, in global level, if you take companies like Teledoc and all, they are now looking at AI-driven telemedicine platforms. So it's not a physical doctor anymore. So they are looking at AI-driven tools. But having said that, always, since we are talking about public health, we need to be very, very careful when we are moving on to the technological aspect when it comes to industries like healthcare. Therefore, it's always important to check what are the regulatory requirements around that as well. So, Sri Lanka, again, SLMC in the progress of developing a sound system or a regulatory system around this industry. Right now, it's at the draft level. But yes, we are currently following the global standards like HIPAA and all, which is given by the American Medical Association. Like I said, innovation should be good, but we have to go ahead with the compliance requirements and the safety of the people as well. So that's the current strategy that we are following, and I feel SLMC will also come up with a good set of regulations in near future.
How do you cultivate a culture of innovation within your team, and what role does leadership play in driving that culture forward?
Again, so innovation should be done very carefully, because just because something is seen in the market, we are adapting that, that is not a good trend to have. Plus, innovation should be a culture within an organization. It's not a one thing that is driven by only the leader. It should be from the entire team itself. So starting from our founder, Mr. Heshanka Fernando, that has been the concept with oDoc always. So what we believe is always the innovation should be a team effort. So in our case, not just me, my entire team, my head of operations or whatever, the entire team, we work together. We check for market trends, and depending on that, we decide what to be done and what not to be done. For an example, right now we are talking about the telemedicine aspect only, but globally, this is not a medicine aspect anymore. We are looking at a lifestyle now. So when we check the market, what we realized was in certain countries, I'm not saying this is a very famous thing, but in certain countries, what we have realized is now this has become a lifestyle. So the tele lifestyle concept is evolving in the global concept. So this is where not only medical professionals, any kind of a professional, even musicians now. So we are looking at that kind of aspect. So we also evolved from that because we saw a market requirement for that. So it is not my idea. It was came from the team itself. So when we work together, when all of us are following the trends, it's very easy when we are looking at an innovation perspective, because it's a teamwork after that. So I feel the leader's role is to get the comments from the team, evaluate what is relevant and what is not, and try to grow based on what the team is delivering to you. Otherwise, if you don't hear to them, they might get motivated. They might get demotivated, which is the worst thing that can happen to an organization. So we always have to listen to our team, let them think around, let them to watch around the market, come up with new concept, then groom that, then convert it into a marketable product.
How do you ensure that the platform continues to stay ahead of technological trends and addresses the evolving needs of both patients and doctors?
Right. So again, that's a good question, because Like I said, now globally we are looking at different avenues. So now we are looking at avenues like from home caring yourself. Like we don't need to get a consultation itself, but the preventive aspect of it. So there are a lot of global platforms are looking into that those kind of aspects also. And if you take certain companies like Mercy Virtual Care, they are looking at platforms like a virtual hospital itself, not just medicine. So it's a virtual hospital itself. So we are also looking into these kind of avenues. So it's all about working together, collaborations, and how to move forward together with everyone in the team.
Where do you see the digital health industry in the next few years, and what part will your company play in shaping that future?
Right. So I hope you are raising the question from the global aspect.
Of course, yes.
Right. So like I said, now telemedicine has moved into two different avenues. One is virtual hospital itself. So rather than speaking into medicine. Apart from that, like I said, it's moving into the lifestyle aspect also. So we are already into the lifestyle aspect. Now we are trying to move on to the AI driven aspect as well as the virtual hospital concept in future. But yet again, like I answered to your first question, this should be done with very carefully because it's a public healthcare that we are looking at. So just because we feel it is good, it's not good to implement that. Have to do a lot of testing and have to get the concept of lot of parties. Just because we want, we cannot implement because this is a highly regulated industry. So right now, I would say the future, maybe within next 3 to 5 years, globally we are looking at AI driven medical associates plus the lifestyle aspect of it. But in Sri Lanka, it will take some more time because still we are in the pace of growing here. We are not in the matured state for this kind of a product. Plus, we still have the mentality where if you don't go to the hospital, if the doctor don't touch you, you don't feel that you got the medicines. That concept, that aspect is there. It's in our blood because we are not used to this kind of a technological avenue. But with the passage of time, so example, before COVID, we never knew that we can do hybrid learning. We were only thinking about physical classes and all. But now, everyone is moving into hybrid learning. Similarly, gradually, Sri Lanka will evolve in this area as well. But like I said, globally, we are looking at now AI driven medical support.
How do you balance convenience with maintaining high quality care through telemedicine?
Right. So, the most important thing, I would say, second most important thing in telemedicine would be convenience. The most important thing is correct diagnosis. But second most important thing, I would say, it's all about the convenience for the patient and for the doctor both. So, right now, what happens is we are looking at different avenues. Like if you want to do a medical checkup, how can we arrange that? If you want to get your medicine delivered, how can we arrange that? And if you want to do a lab test, how can we arrange that? So these things cannot be done individually. So we need to partner up with different organizations, maybe some hospitals, maybe certain lab service providers, maybe certain medical delivery providers. So we have collaborated already, but we are planning to expand that to the next level where the people can get a proper convenient service at their home itself.
Telemedicine is embracing it as a lifestyle solution. We were in conversation with Mr. Lahiru Karunarathna, CEO of oDoc Private Limited. Thank you very much for connecting.
Thank you.